Hi, welcome to Gene Rants. I'm Gene, and today we're going to be talking about shutdowns and healthcare, or more accurately, Obamacare, the failures of Obamacare, which is why, well, there was during COVID, this whole shutdown. Well, what it's really about is Chuck Schumer's reelection. He's going, well, I got news for you, Chuck. He's afraid of being primaried by Alexandria Ocasio Cortez for the next senatorial election, and when he's up again, and he's afraid of being primaried by her. Polls show, I've seen a couple of polls, they show that she would handily win. So he's trying to avoid that. So he's he's engineering this government shutdown. But I got news for you, Chuck. She's going to primary you anyways, and you're going to lose because if the polls show she's a representative right now, why not go for the senator when all the polls show that you would win? And the worst that could happen is you would lose, and you would still be a representative. So she's going to do it. So you might as well do the right thing, Chuck. Open the government. But the reason I'm talking about this today is there was a Democrat representative, Ro Khanna, who was on Fox Business Channel earlier today, the day before you were seeing this, to talk about the shutdown and about why it was about extending that the Republicans, why won't they talk about extending, why won't they deal with the Democrats when they've said over and over again, the Republicans have said, we're happy to talk about anything you want to talk about once the government is reopened, but we're not going to let you hold the country hostage and force us to give you something, $1.5 trillion of new spending. We're not going to do it. So that's where we are right now. Now we have the largest federal employees union. Yeah, this was yesterday's vlog, that they are calling on the Democrats. That's a very big. They are the largest federal employees union. Strong, the unions, right? Strong Democrat backers, and they are urging the Democrats to vote to reopen the government. So you have Ro Khanna saying that, well, it turned into a discussion of Obamacare. Now, remember, Obamacare promised that if you want your insurance, you could keep it, that if you want your doctor, you can keep them, if that insurance premiums would go down and the deficit would go down too. Of course, none of those things turned out to be true. I recall very vividly getting my letter from my insurance company saying that they were canceling my insurance and putting me into it without even asking me. So we automatically, we're just going ahead and enrolling you in this other insurance, which I didn't want. So I canceled that and I went and got insurance somewhere else. Because I said I don't want to be on an Obamacare exchange, and I was told that, well, okay, I can find you something out on the exchange, but they have to follow the same rules that Obamacare does, so it's going to be the same either way. So there you go. So Ro Khanna being asked, he was asked flat out, do you consider Obamacare a success? And he said yes, he considers it a success, and he said it wasn't a success because without Obamacare, insurance premiums would be even higher, which is absurd. They would not be anything what they are. You wouldn't need these massive subsidies. I know from my own brother, actually, he had insurance, and as it was canceled, they put him into, he needed a subsidy. He said if he didn't get the subsidy, that if he didn't go on Obamacare, his insurance would go up $14,000 a year. All right. Now, before that, my insurance was going up maybe $100 a month, so $1,200 a year, which is nothing to sneeze at. But it's nothing like 14,000. So basically, Ro Khanna, he just says, well, it would have been worse without it. I don't believe that for a second. And the cost curve was not that was his famous word. Obama said the cost curve would be bent down. But what really got me, Ro Khanna, this gets me all the time. Ro Khanna said, well, where is the Republicans' plan? Why they're complaining, but the Republicans, where is their plan? Well, because apparently they don't think, I guess they missed, they think that the Republicans don't have one. Well, apparently Ro Khanna missed the House Republican leadership's press conference the day before, was saying that, well, I'm going to turn the floor over right now to Mike Johnson, the Speaker of the House, talking about the Republican health plan that supposedly doesn't exist.
Yes, sir. Second row.
Is there any work being done on a Republican solution to the healthcare cliff? I mean, there's been talk in the past about HSAs, about a short-term plan. Any work being done? You said it could be done at the end of the year, but surely there must be some preliminary work.
Yeah, I've been carrying this visual aid around waiting for this question for a while, okay? So when I say that the Republicans have been working on a fix for health care, we've been doing this for years. And many of you who've been on this beat for a while know this is two publications. When I was chair of the Republican Study Committee, the largest caucus of Republicans in Congress, we published volumes of ideas on health care. This was our volume 1, a framework for personalized, affordable care. We had an entire body of the smartest minds in Congress, the smartest Republican minds who worked around the clock. The Doctors Caucus, they talked to stakeholders from around the country and in all the areas related to healthcare, and they came up with a formula on how to reduce the cost of healthcare dramatically, how to make Obamacare affordable and workable in some way for the American people, to increase the access to care and the quality of care. And these ideas have been on paper for a long time. There's volumes of this stuff, volumes of it. What we're doing right now, what we have been doing, what we were already doing, because we knew we were coming up to the end of the year, and we know that healthcare is a major burden for the American people. We've been working on it since day one of this Congress. We worked on it in the years prior. And we've already demonstrated, this is not talking points for us. When we say the Republican Party is the only party that has any chance at fixing healthcare for the American people, we've demonstrated it. We put it into the One Big Beautiful Bill, the Working Families Tax Cut. As you know, we strengthened the Medicaid program. We started there because it was the lowest hanging fruit. Why? Because the fraud is so glaring. And we eliminated the fraud. We got ineligible recipients off of Medicaid. We preserved it for the people who rely upon it and need it the most. Young pregnant women, the elderly, disabled, for example. We got able-bodied young men without dependents off the program. And what we did was we strengthened it. Don't take our word for it. The CBO, who normally is not on my team, okay? They're the ones that came out and said, yeah, it's going to save $185 billion. And they got 2.3 million ineligible recipients off of it already. That's an important first start. And so the next thing is to fix all the other components of healthcare. That's what we have plans to do. That's what we're working on. The expiring Obamacare subsidy at the end of the year is a serious problem, because if you look at it objectively, you know that it is subsidizing bad policy. We're throwing good money at a bad, broken system, and so it needs real reforms. The reason it was never appropriate or never possible to be resolved on a simple CR, stopgap funding measure, is because it's very complicated to fix. But Republicans have a long list of ideas. Leader Scalise has been working with the chairman of our 3 committees of jurisdiction, putting all of that, formulating all that, grabbing the best ideas that we've had for years to put it on paper and make it work. But we know we're going to have to arm wrestle with Democrats over that. Why? Because many of them are avowed to get us to a single-payer system. They do love socialism, my friends. They love Mondami. He wants government to take over everything. They're on board with that program. They think the government can do a better job by taking over healthcare. We believe in the private sector and the free market and individual providers, their acumen. And we say that if you take the government off their backs and allow for real competition again in healthcare, you will improve its quality and you will bring down its cost. All of these are important components of that, and we have a lot of work to do, but it is not a simple thing, and I am not going to go in a back room with Chuck Schumer, like he keeps demanding, with 4 people and make this decision. I will not do it. It's not appropriate. It's not right. It's too complicated for that. We need all the members to have buy-in. We need to have these healthy debates and discussions, but we can't do it while they're shutting the government down to appease the Marxist. That's it. That should be your headline.
And there you go. You just saw and heard it. That was Mike Johnson explaining that the Republicans do, in fact, have a plan. He showed, it was about that thick, right? the documentation of the plan, and he said he would be happy to, because that's what's going to happen is the government is going to reopen, and what will probably happen, I could be wrong, this is my prediction, but the subsidies will very possibly could be extended temporarily, again, but it would definitely be temporary. But most of all important is some of those reforms that Mike Johnson talked about and others would be part of the bargain. Your traditional horse trading, there would have to be dramatic changes to Obamacare if the Democrats want any subsidies extended, and there's not going to be a hostage deal. The Republicans are not going to negotiate now with the government shut. That's where we are. But the point I'm making is, yes, Virginia, there is a Republican plan, and we'll see where it goes. Your comments welcome in the comment section below the video. If you could subscribe, that would really be great. Share this video with anyone you think would benefit from it. But most of all, come back and see me again. I would love to see all of you again. And until I do see all of you again, bye.